Hello, I'm Ryan Ferdyhurt with the Center for Practical Bioethics, and this is the Clinical Ethics Corner. There is an always interesting interplay between bioethics and the law. Bioethics is what is the right thing to do, while law is often what are we able to do. So situations can exist where what is legally supported is not always what is ethically supported. What do you do when these two ideas conflict with each other? Do you prioritize what you know is right for the patient, or do you do what is legally supported? We had a situation one time where a patient was in his mid-50s. He was an unrepresented patient. He did not have an advance directive. He had been found down, came to the hospital, had diabetic ulcers, and was needing an amputation. Because the patient was not able to respond or participate, he lacked capacity, we didn't know would the patient consent to the amputation. When we talked to our legal team, the legal team said that we were not allowed to amputate the patient because he was not able to consent for the surgery. We asked that, but he's going to get sicker and sicker. He's going to become septic, and then eventually he's going to die. Legal said, well, in that situation, yes, we can do assumed consent and do emergency decision making, and we can act. But we weren't allowed to act until the patient got critically ill enough. So this became a very morally distressing situation for myself and the rest of the medical team, where we would come to the hospital for multiple days in a row and kind of ask, is he sick enough or is he close enough to death that we can then save his life? And that was the difficulty. We understood what the legal team was supporting, but also we knew what was in the best interest of the patient and where this clinical situation was going, and we felt like we were having our hands tied in allowing harm to come to this patient because of the law. So in theory, policies are designed to protect patients and also to protect society's best interests. But when those laws come into conflict with their intention or what they're trying to achieve, they can become more burdensome and actually go counter to what their original intention was. So in those situations, laws truly can cause harm. So what we take away from these situations are what should take priority, the law or ethics? In this scenario, what would be your first reaction to this patient? What would be what's right for this patient? And is the law supportive of that? And what do you do whenever the law is not there? Is the law there to protect us from rash judgments, or should we operate in a more ethically knowledgeable way? And what is due to this patient? How can ethics best support this patient? Again, I'm Ryan Ferdyhurt, and this has been the Clinical Ethics Corner. Thank you.